All right, everyone. So, again, thank you, Dr. Morgan, for joining me. If anybody happens not to know who she is, which would be amazing, but so Dr. Morgan, she received her doctorate's degree of veterinary medicine from the University of Illinois College of Veterinary Medicine in back when, 1984?
1984 is my veterinary degree.
Wow.
That makes me old.
I wasn't going to go there. So,
it's
but
okay.
You're also certified as a accredited veterinary acupuncturist, chiropractitioner, and a food therapist.
Yep.
And you also combine your holistic medicine into your standard practice of care as well.
I do. I feel like having integrated modalities, it gives me much better success rate than just doing all of one or the other.
Yes, definitely so. And then for everyone watching, we will take questions at the end of this, so please hold your questions for that. And so let's get on topic and ask away. First question I will ask you is, why is fresh feeding better than processed foods for dogs, especially dogs dealing with chronic ailments such as MVD?
Well, anybody who follows me or has seen me speak or give seminars or any of my webinars knows that I am just a huge fan of feeding whole foods to our pets. So whether that's raw, gently cooked, however you want to do that, if you really compare it to even, what we as people should eat. If you have a diet of processed foods and that's the only thing you ever eat, your health is going to suffer. I have a cousin, she and her husband live in a community where there's a fast food restaurant on every corner. So every meal is fast food takeout, breakfast, lunch, and dinner. Needless to say, she and her husband are both very overweight. They suffer from chronic disease. She was diagnosed probably 10 years ago with MS, and they struggle with their health on a day-to-day basis. And so we see the same thing in our pets. Most of us, I think probably everybody on this feed, would not eat the way that my cousin's family does, that we would not be hanging out at McDonald's and Burger King and Chick-fil-A and KFC for every single one of our meals. But when we're putting all processed food into, highly processed food, like dry kibble, when we're putting that into the bowl, and that's the only thing that we're putting into the bowl, we're basically feeding dead food. There's no life. And so if you want to have a really good, healthy life, then you need to feed good, healthy, whole foods. And, not everyone is a raw feeder. That's fine. We find that less than 5% of people are willing to feed raw. That's okay. But any fresh whole foods, there was a great study, I believe it was done in Purdue. It's been a while ago now, probably at least 10 years ago, where they took a set of dogs and they compared feeding one group only a dry kibble and the other group got the dry kibble and then had about 25% fresh veggies added to their meals. And the dogs fed the fresh veggies had increased health and longevity by about 30%. So just adding that little tiny bit of real food to the bowl made a huge difference for those dogs. And so I think as we get more health conscious for ourselves, I mean, you just went through this with your own health scare and, tried to die.
Yes.
Thank you did not. Thank you very much. But you've discovered, just through your own health that changing how you eat takes the weight off, decreases the chronic inflammation and illness within the body. My husband, Hugh, has been diagnosed as being diabetic. And of course, the traditional doctors said, hey, you've got to start taking these drugs. You've got to bring that blood sugar down. And this is how we're going to do it. They never talked to him at all about changing his diet or doing anything proactive as a change. They just wanted to go with drugs. And instead, Hugh went to our naturopath and he's getting acupuncture. And he said, okay, how do I change my diet to change what's going on in my body? And he decided to go with a keto diet and give up the carbs and give up anything with sugar. And just by doing that, within a month, his average blood sugar has gone from 160 down to 125. And he's losing weight without trying, and he feels better. So, but it's a hard lifestyle to accomplish. For instance, yesterday we were out all day. And so, everybody's getting a little hangry by mid afternoon after having breakfast early in the morning.
Yes.
Hugh cannot just run into a fast food place. He can't run into Dunkin' Donuts. He can't run into the little corner store and find something that is going to fit his diet. So the rest of us, ate things that were not so healthy for us. But when I get hangry, Hugh pretty much knows at this point a hangry Judy is just no fun at all. So,
Yeah,
but
same as my wife.
for the healthy lifestyle. So if you want to lead that healthier lifestyle, it requires planning ahead. So the same thing goes with our pets. If you want to feed them healthy food and not just use the convenience of pouring dry kibble into a bowl, then you're going to have to plan ahead a little bit. For those of us who are feeding raw and we're feeding frozen raw products, if you don't remember to thaw something out, you've got that little dilemma in your hands. Now, in my household, I'm just like, oh, wow, we didn't thaw anything out. Okay, well, I can make some eggs for them. I can, open some sardines and add it to the eggs. I can open a can of organic pumpkin, and I'll just, a little of this, a little of that, but it's still something that's fresh and healthy and wholesome for them.
Yes, absolutely. And I learned that as well, with like you said, it's not easy finding flavorful food for that matter. My dear wife has been cooking up a storm and trying to figure out how to piece together flavor into healthier foods that aren't so processed, and that's been a struggle, but she's doing great, and I'm enjoying figuring it all out.
Oh, sure.
And
I think you get much better with spices and those sort of things. But I have to say, years ago, I gave up sugar. And what I discovered is that many of the foods that I always thought were bland have so much flavor. Like I find that pumpkin is an incredibly sweet food. Coconut is an incredibly sweet food. But
yes,
we don't realize it because we're so busy stuffing refined sugar into our face that we don't appreciate the flavors. And unfortunately, with my head injury back in August, I've lost my sense of taste and smell. And
wow,
that's devastating because I'm a foodie. And so I can taste little bits of things, but the really interesting thing, what this has done is anything that has a petroleum base or a chemical base, like processed foods that have coatings and things on them, all I taste is petroleum now. So it's really
yeah,
easy to stay away from that stuff because the taste buds that are left are the ones that say, "Oh my God, chemicals, chemicals, chemicals." And I don't think we even realize how much chemical stuff is in our world until something like this happens. And I'm a pretty good taste tester now, so if you want to know what has chemicals in it, Coca-Cola to me right now tastes like straight petroleum. I might as well just stick the gasoline tank in my mouth.
yeah.
I mean,
I've
terrible.
noticed that as well. Since it's been about 2 months, I've been eating more plant-based. I've really noticed when I cheat one day and have that cookie or something. Don't tell my wife. Um, it tastes way different. Like I don't. I never really did do a lot of sugar and stuff, but yeah, when I do kind of have that cheat day, I can taste it.
Yeah,
So it's taught me a lot about nutrition and listening to what I do with my dog
yeah, absolutely.
because I give her raw food and um, she does amazing. Then with myself, it's having to get myself in the habit of what I do with her.
Yes,
So it's been
exactly.
challenging. So
I've had a lot of clients who have changed the way they eat because they changed the way their dogs eat. I had one couple that between the husband and wife, they lost over 100 pounds in a year
wow,
because they were feeding their dogs really healthy. They had a dog with cancer, and so they totally changed what they were doing. And she came in the next year, and I didn't recognize her at all. And I said, "What have you done?" And she pulled out a picture of them a year earlier. And I said, that is amazing. And she said, thank you. You gave us our lives back. And so, our dogs can teach us so much for ourselves as well.
I know. Plus, I've lost like almost 19 pounds in 2 months. My wife hates me for that, but it feels good being in a much better place. So
Absolutely.
now that we've been talking about fresh food with dogs, let's go down the rabbit hole a little bit with some of the unsavory brands. So what are the ingredients in processed diets that we mentioned, like in Science Diet, Royal Canin? I have a lot, as dealing with a cardiac group, I deal with a lot of people that go to veterinarians who suggest, Science Diet or Royal Canin because their dog's dealing with a heart problem. And
Right.
let's talk a little bit about the ingredients in this stuff.
Yeah, and unfortunately, that conversation has gotten worse since this whole DCM thing. Um, and that is a huge frustration for me. And cardiologists, they're mired in traditional medicine. I have yet to meet a cardiologist who is also an alternative practitioner. They're really steeped in traditional medicine. And so I get emails on a daily basis from people saying, okay, well, I went to the cardiologist, my dog is in stage B1, B2, C, whatever. And I asked my cardiologist about diet, and they get recommended one of the big pet food company prescription diets, and they get told, it needs to be low salt, and when people, and it can't be the grain-free diets now, they're being told. And we have no proof that that's even a problem. I think it is a problem, but I don't think it's a problem for the reasons that most people are saying. But the solution is not to go back to feeding a different processed food with grains in it. That's just crap. And the whole thing with salt in the diet, dog foods, that's carried over from the human cardiologist. Salt is not put in any dog food in a high enough most dog foods, I can't say any, most dog foods in a high enough quantity that it's really going to be a problem, but salt can be used as a preservative. What I see more often in pet foods is for preservatives, they use BHA, BHT, which are carcinogens, ethoxyquin, which is not listed on the label, but can be in there if there is fish meal in there. That's a carcinogen. They will use sugars, and sugar, I don't know if it was you posted it and I stole it and shared it, but like 121 different names for sugar that you can find on many pet food bags, because sugar makes a great preservative. And there's no need for our pets to be eating a lot of sugars, just like there's no need for us, because it just causes inflammation. So a lot of the foods are very low in high quality proteins. And the heart is a muscle. And in order to have strong muscle, we need high quality protein. And for our dogs with heart problems, we're not going to get a vegan dog. For those of you who are vegans out there, I'll apologize if I offend you, but I will not apologize for my opinions that dogs need high quality meat proteins in order to have good heart function. And for those with kitty cats, absolutely vegan meals makes 0 sense at all. They are obligate carnivores. They really need it. And I don't care how much taurine you supplement in a pill form, it's just not going to get you where you need to be. So, on these highly processed dry kibbles, many of those ingredients are cooked at high heat up to 5 times by the time it gets to the end product in the bag. Now, think about that. If you were making, let's say you were even making a meatloaf, and your meatloaf has 30% meat and then 70% of just fillers. When
Yes.
meatloaf was originally made back in the 50s, when people were struggling, the 40s and 50s, when people were struggling to make ends meet. So you'd add a lot of bread, you'd add a lot of vegetables. I mean, my mom used to make it with anything that was left over in the refrigerator and then a little bit of hamburger to hold it together. And, so if you said, okay, I'm going to make that meatloaf and I'm going to pre-cook everything that's going into it, and then I'm going to mix it all together and I'm going to cook it 4 more times. That's, take it out of the fridge, cook it, take it out of the fridge, cook it. Do that 5 times. You are left with a disintegrated pile of non-nutritive crap.
Yep.
And that's pretty similar to what we're getting in these bags of food. There's a lot of fillers, there's a lot of fibers in there, and the nutrition has literally been cooked out of it. And they don't start with the highest quality ingredients. So when you see chicken on the label, you're thinking that chicken that you're buying in the grocery store to put on your plate, that is not the chicken that is going into those foods. You're getting all the 4D meats. You're anything that is a meal is probably rendered, particularly from the bigger companies. And the rendering process and a lot of the fats that are added, that's where we get that euthanasia solution that is found in so many of these foods. And interestingly, many times FDA has said, yep, the euthanasia pentobarbital solution in pet food is a much bigger problem than what we are acknowledging. And they don't even do recalls when it is found in foods unless an animal dies. So if an animal dies or enough animals get sick that it's reported, then they might talk to the company. But there have been many companies over the past couple of years that have had pentobarbital in their dry and canned foods, and FDA has not even made them do a recall.
Which is
So
crazy.
it is totally crazy, and I'll be darned if I am going to feed my animals something that is processed by a company that I don't know their standards, I don't know their sourcing. And that's one of the reasons I really appreciate Susan Thixton at Truth About Pet Food, who puts out her list. Yes, you do have to buy the list. If you knew the hundreds of hours that she puts into that, I had a bunch of people complain about that. I actually had to block somebody from my page because they were complaining about having to pay for the list. And I'm like, really? Because she puts in hundreds and hundreds and hundreds of hours. You people are crazy. It is worth paying for because
It's just $10.
it's whatever you want to pay.
Yeah, exactly.
So before I was really good friends with Susan, I would send her $100 for the list. That's how important the list was to me. And I would not share that list. And, it's very important because we want her to do that work. But one of the things that she does with that work is those companies have to show their bills of lading. They have to show where the ingredients came from, the farms that they came from, so that we know that what we're getting is high quality, that we're not getting rendered products, that we're not getting things that are going to have pentobarbital in them. So that is crucial. And when we're feeding these dry processed foods, we're feeding a dead product with suspicious sourcing and many times very poor sourcing. And that is not going to give us good health in general, but particularly these dogs with heart disease, they're struggling on a daily basis just to keep their heart functioning, keep it stable, prevent, disintegration of that heart function. Our little Pookie, who we lost to something totally not heart related, was on all the cardiac meds for 7 years. And she had very minimal decline in her heart function over those 7 years. We always thought that her death would be due to heart disease because she was so bad. And yet that was not her issue. And I credit the food that we feed our dogs. I mean, Charlie's going to be 19 next month. And
Wow.
he's been on heart meds, started at 16. So he was one who had a very good heart till very late. But I don't think that we would have him and he would not have waited until 16 if he had been fed horrible food. And between the food and the supplements, I think that the longevity increase in these dogs is huge. And it's interesting, the cardiologist that we've used for our dogs, I've had the same cardiologist for the entire 35 years I've been in practice. I keep telling him he can't retire before I do because I wouldn't want to send my patients. But he's interesting. He's a very traditional guy. And when I send a patient to him, he'll prescribe the medication and then he will turn around and say to them, and you go back to Dr. Morgan and you find out what supplements and what diet she wants you to use because she's got something figured out here.
Yes.
And I appreciate that.
Yeah. And just so people are aware, what is 4D meat? What does that actually stand for?
Everybody uses their own 4 words, but it's disease, downer, dying,
Dead.
Dead.
Yeah. Basically, don't use it.
Right. So that could be a cow that died out in the field 3 days ago, got picked up by the dead animal guy, thrown on the back of his truck, sat out in the sun for a couple of days, then ended up at the rendering plant, sat out in the sun there for a couple of days, bloated, disgusting, and then got boiled down into. They boil it down and they boil off the fat and they skim that, and that's the fat
Yep.
products that are the tallow that's used in foods for flavoring and for appetite enhancement. And then the rest of that is dehydrated to make the meat meals. So if you see meat meal, it can be any animal, and that's unfortunately where we see, the dead zoo animals and dogs and cats can be in there.
Roadkill.
Roadkill, it can be anything, and it's pretty interesting. There was a study 4 or 5 years ago where they took a whole bunch of different dog foods that had meat meals and things in them, and they looked at what the label said that it had in it. So it might have said, it's a beef product or it was a chicken product, but it would, they have to list on the label what the different proteins are that are in there. And they tested they did DNA testing to see what proteins actually were in the food versus what it said on the label. And I think it was over 70% of them did not match. So for those of you with animals with allergies and you're like, oh, I know he's got a chicken allergy. Well, if you're having problems with a food, there's good chance there's some chicken in there, because especially if it's a highly processed food, because they don't match. And the interesting thing was they tested foods at all levels. They tested prescription diets, they tested low quality diets, they tested high quality diets. They didn't match. And for those high quality diets, it's kind of like the Hills thing with the vitamin D, where they say that they test every batch of supplement that comes in. Well, clearly they didn't, or they would have known that the vitamin D content was 1,000 times too high. So, just because you're paying more, if you don't know the sourcing and if we don't know the ethics of that company,
Don't use them.
Yeah, I mean, it's really hard.
If you can't go to that company,
it's very hard to know.
Yeah, and if you can't go to that company and ask them start to finish, how do you do your food? And they won't tell you, don't use them.
Right.
Because, putting that in your animal's mouth, you should know exactly the whole process.
And frankly, they can put whatever they want on their website. Nobody really cracks down on their websites unless it's egregious. One of the companies that actually I have a presentation that I've given a few times, where I went to a bunch of different websites and took down their little statements, like, we use only the highest quality, wholesome ingredients, blah, blah, blah. And I went to like 5 different websites of companies that had been caught with pentobarbital in their food and then had their little statements of quality. It's like, really? So on your website, you say that you only use high quality, blah, 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 blah. And yet all of you have been caught with pentobarbital in your food. So if you consider pentobarbital, which is euthanasia solution, high quality, then by all means, I don't.
Yes. It's scary that is allowed to happen. And who governs the regulations in this? Can you talk about who these companies are?
Well, so really they all fall under FDA and CVM, which is the Center for Veterinary Medicine, which is just a branch of FDA. But under them, it frankly comes down to each individual state. And so each state's Division of Consumer Affairs, Department of Ag, whichever one they put it under, that's who governs it. So a lot of times, the testing that is being done, that's not FDA walking into somewhere. That is the state government sending their representative in to pull food out of a freezer, to pull food off a shelf. And frankly, they spend more time correcting labeling issues, like not making claims on the label, like our food will make your dog live longer, unless you actually have studies that prove that. You can't make those label claims. They spend more time worrying about the font and the size of the letters than they do about what's going into the bag, box, or can. It's a totally screwed up way of governing what goes into our animals.
Yeah, I was very surprised about AFCO and how they aren't letting you guys attend any more public meetings that you have a right to go
Public
to.
meetings that we're banned from,
That,
and why we're banned because we're friends with a company with Answers who's suing them. And, I sent them a letter and said, I frankly think that what you're doing is illegal. You can't ban me. I have no association with that company. I do not represent them. I do not work for them. I do not get paid by them. Literally no association other than we're friends and we sit together at the meetings. And they're afraid. Susan sent me. They posted, the latest thing they posted was that they were afraid that we would interrupt and cause, I forget what word they called us, but that we were going to interrupt their meeting and cause problems for them. And I'm like, okay, well, I've been at your meetings for the past 5 years, and pretty much I'll get up to the microphone once every meeting. And I always say something they don't like. At the last meeting, I spoke out against the prescription diets that are being put out, being sold as a prescription. You have to have a written prescription from your veterinarian to get it. And I said, well, this is collusion because it's being sold as a prescription product that you have to have a prescription from your veterinarian. They charge twice what, the food in a different bag, box, or can would be worth. And you have to have the prescription to get it. However, none of those foods have been tested as rigorously as you would have to in order to get a prescription drug. So to get a prescription drug to market, it's anywhere from 7 to 15 years of research and proof. They don't do that with these foods. They put them together, put them on the market, and say you need a prescription for it. It's kind of crap. And I
yeah,
called them out, and they didn't like my answer.
yeah, it's unbelievable. So let's kind of talk about the why do vets recommend such foods?
Money.
What are their trainings?
Well, yeah, so that's the problem. They recommend them because it is a huge profit center. So I went to, a few years ago, I was at oh my gosh, a business meeting for veterinarians, how to increase profits in your practice. All right, fine. While we all love animals and we would like to do this just out of the kindness of our heart, it is still a business. I have employees that I have to pay and, health insurance and all, just like a regular business. So, I went to this business meeting and they said, well, if you are not selling prescription diets, you are missing the boat because that can make up to 20% of your practice income. So it is huge as far as practice income. The other problem is that veterinarians don't get much nutrition training. And I have a new grad in my office, so we talk about this a lot. And she said, and she went to University of Connecticut for her undergrad, and she said, "Oh man, I had a really good nutrition course in undergraduate. In vet school, no." And she ended up she went to University of Illinois, which is where I went, so it's kind of funny, but. And I said, so in medicine class, did they teach you how to use whole foods at all for, treating kidney disease, heart disease, whatever? And she said, no, we had to learn, the alphabet soup for the prescription diets. For kidney disease, it's going to be KD or, NF. I mean, all the different, I don't even know them anymore because I don't use them. But that's really what they teach the veterinarians. So if you go to your traditional veterinarian and you say, look, I don't want to feed a prescription food, they throw their hands up in the air and say, well, I don't know what else to recommend. No, you can't cook for your dog. There's no way you'll get it balanced. There's no way you'll get it right. You'll kill them. And unfortunately, that's what the pet owners are being told. And the veterinarians many times will get really defensive when you question them about it. Many of them now are aware of the website Balance It. So Balance It, you can go to, and your veterinarian can go to, and you basically get to pick one protein, one carb, one vegetable, and then use a synthetic vitamin mineral supplement to balance the food. And I get a lot of people coming to me saying, well, I paid, $500 to go to a board certified veterinary nutritionist, and this is what I got. I have, and most of them will tell you one diet. They'll give you one recipe. And if you want a second recipe, you get to pay over again to get a second recipe. Now, all they're doing is going to that computer program and plugging in, check chicken or beef or fish, whatever you want. Check which starch you want. Do you want a sweet potato, a white potato, a rice? And then which vegetable? Do you want green beans? Do you want peas? Do you want spinach? And then you add this synthetic supplement. The dogs hate it. The owners hate it. I hate it. And when people come to me, I look at them and say, well, wouldn't you rather feed whole foods? Wouldn't you rather have some variety? I mean, think about this. If you went to the pediatrician and they said, okay, you're going to feed your child chicken, white potatoes, and green beans and a multivitamin every meal for the rest of his life, you would say, you are out of your ever-loving mind. My kid's going to get bored and throw it at me. He's not going to eat, and he's going to suffer from poor nutrition. You cannot get all of your nutrients out of a pill or a powder. It's just, that's not healthy nutrition. That would be just the same as eating all processed, okay, I'm going to survive on Doritos for the rest of my life. Yum.
Yep.
You can't have optimal health doing that. But the veterinarians don't. It's interesting. The last course I took down at the Chi Institute in Florida, which is the where we learn acupuncture and chiropractic or Chinese medicine, and the course that I was taking was on hospice and palliative care, and so we talked a lot about nutrition for treating these senior animals with kidney disease, heart disease, whatever. And there were probably 40 veterinarians in the room, and I would say the majority of them had taken the food therapy course at the Chi Institute. And it just so happened that my yin and yang nutrition book had come out fairly new to that, and I had a copy with me. And Dr. Shea said, "Oh, we need to sell this through the Chi Institute because it uses regular foods that are easy to find for the most part." But I had so many veterinarians in that room come up to me and say, "Look, I've taken the food therapy course. I still can't figure out how to put diets together. Will you come teach my staff and me how to do this?" Because we all get the theory on it, but then putting it together. So even veterinarians who have taken the courses still struggle with how to put it together. It takes a lot of time and effort to figure out how to do it and to get it balanced and what we need to add to it. And not everybody has the time or the inclination to want to do that. And so many veterinarians are frustrated by it, but then they get defensive because they don't want you to think that they're just not smart enough to figure it out. It's not that they're not smart enough. They just don't have time and maybe it's not their thing.
So what's the best way to approach your vet about these food, not wanting to feed these processed foods and going, a more whole food way?
So, I mean, frankly, you are the pet's owner. And you can just give your veterinarian a hard no and just say, no, I'm not going to do that. I do not believe in the nutritional value of those foods. I don't want to pay double for a prescription diet when I think that, I can supply good nutrition to my pet and I'd like to do it with whole foods. They might, I mean, sometimes you just have to agree to disagree. And it might be that you just need to say to them, well, I'm not going to feed that food. I know that I can find other ways. And, if you want to kind of quiet them down a little bit, you can say, well, would you refer me to a veterinary nutritionist? And they're going to refer you to somebody who's going to give you the Balance It website and give you your one little recipe. That's fine. Take it with a smile on your face and say, thank you so much for helping me out. And then, do whatever you want to do with that. So, I mean, there are books out there. There are resources out there. I have tons of videos out there. The book that I'm talking about, I don't know if this will show up. The Yin and Yang Nutrition for Dogs.
Great book.
So this cookbook, there's a bunch of heart recipes in there, but there's also kidney and liver. And the recipes have worked. And we've been getting a ton of testimonials from people telling us, I found you 2 years ago and I've been cooking for my dog and my veterinarian said I couldn't do it and it wouldn't work. And look, the liver enzymes are down to normal and his kidney disease is stable and, his heart hasn't progressed at all. One thing I will say for anybody who's using our recipes or our book, please, 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 please do not just open it up to heart disease and go, oh, look, heart chi tonic, which is an energy tonic, and just make that recipe and think that you have accomplished everything that you need to accomplish. There is a chapter in the back of the book. I probably should have put it in the front, but it's called The Balancing Act. And the Balancing Act tells you how to make sure you're getting all the vitamins and minerals that you need. Um, because each recipe as a standalone is not balanced. And so that's where I've gotten complaints from some veterinarians. You know, I'll get emails from veterinarians saying, well, I have a client who's making this recipe and it clearly is not balanced. So I'm like, you're right, it is not, because they need to be adding these things,
Yep.
and that's in there as well. So don't make that mistake. And the other thing that I would highly recommend is that you rotate your recipes. Uh, Again, you would not feed your child chicken, potatoes, and green beans every meal. Your dog doesn't want it either. So
Yep.
rotate recipes, so you can find a couple that fit for what your dog's issues are, and say, okay, well, and if you're like me and you want to make large batches, one day a week or one day a month, that's fine. Pick 2 or 3 recipes, make large batches of each of them, put them in containers, label them with the date, and stick them in the fridge or the freezer, or however long you're making for, and then you can pull them out in rotation. And your dogs aren't going to get tired of it. You're going to cover, your amino acid bases, your vitamin mineral bases, and you'll do very
Yep.
well with these guys.
Yep. Very good advice. So for people that maybe struggle financially with being able to do all this, what are your thoughts or ideas on how they can improve on their pets' nutrition by adding things?
Yeah, so that can actually be really simple. And I have a video that went a little viral that's a little bit crazy, where I went to the grocery store and I just shopped for fresh whole foods,
I
uh,
remember that.
the perimeter of the grocery store, and I looked for things that were on sale and I looked for bargains. So that particular day, all of the boneless chicken thighs and breasts were buy one pack, get one pack free. I was like, all right, I'm going to
Yep.
find the 2 biggest packs in there that I can. And, so it was, chicken was like $2.69 a pound, except that I bought one and got one free. Now we cut the price in half. Now it's $1.35 a pound. That's pretty good for a protein source. If you belong to one of the big box things like Costco or Sam's Club, BJ's, I don't even know which ones exist anymore. I don't go there, but you can buy things in bulk. And, I get people who get hung up on, oh my gosh, grass fed is so expensive, organic is so expensive. Well, you know what? My family doesn't even eat organic grass fed every single meal because, going to Whole Foods, I guess I can use names. I mean, we call it a whole paycheck for a reason.
Exactly.
It's crazy. Um, so, if you have to buy in bulk so that you can do this and bring the price down to something that's reasonable, my stepdaughter has 2 humongous German Shepherds. They are on an extremely tight budget. But she decided, in the past, all of her dogs had diabetes and, chronic health issues. They were just a train wreck. And so um, she and her boyfriend have these 2 Shepherds, and they decided that they were going to, they're actually using them for Schutzen training. They're beautiful dogs. And she knew from knowing me that raw feeding was the way to go for these dogs, but it is not in their budget. So they called up all their friends that are hunters and said, can you drop off any parts of the animal that you are not using for yourself? And so we were at their house one day, and sitting at the end of the driveway, somebody had dropped off these 2 huge bags of deer meat, the heart and the liver and the kidneys and all those parts that, the tongue, all those things that they weren't going to use. And so I do consultations with people from, the Midwest and, big hunting communities. And they're like, oh, well, yeah, we hunt for this, that, and the other thing. And I'm like, well, then why would you not use all that stuff? There are co-ops. I know that her name's not going to come to me. Keep the tail wagging.
Kimberly, yes.
Kimberly, yes. So she ended up getting in with a bunch of co-ops that do raw food. There's a woman that I met from up in Albany that because she was going to local farms and sourcing all of these, leftover body parts for her dogs, she ended up, now she has a huge business where she provides all of this for many raw feeding people in that area. So there are, if you have a little bit of ingenuity and if you really want to find it, you can find cheaper sources. And, locally in the summer, like for us, New Jersey's the Garden State. I know most people don't think of New Jersey that way. Think of New York City and smog, but we're the Garden State. And so in the summer, we've got zucchini and, pumpkins and vegetables coming out our ears. Well, and cranberries. We have cranberry bogs in New Jersey. So, come fall, cranberries are a dime a dozen. I mean, I buy tons of bags of cranberries and throw them in the freezer. So you want to buy things, you might have to invest in a freezer. I would strongly recommend, if you're going to make a lot of your own food, you're going to make raw, gently cooked, whatever, go to Habitat for Humanity, go to a thrift store, find a chest freezer, find somewhere to shove that into your household, whether it's in your garage, it doesn't matter. And then buy in bulk when things are in season and on sale. You can grow your own. We accidentally grew about 500 butternut squash one summer in our backyard. We had composted pony poop that we throw all the vegetables and everything else, and we had dug a ditch to our barn to put in the electric and water line, and then to fill it back in, it kept sinking. So we kept filling it with our compost, and the compost had butternut squash seeds in it. We grew like 500 butternut squash. We just let them take over the whole backyard, because once they started to grow, I was like, this could work out. So we were giving away butternut squash. We took them to the food pantry. We took them to work. I mean, but free butternut squash. It's a phenomenal thing for your pets. By the way, they're really easy to grow. They require zero care.
Oh yeah, Zoe loves that stuff. So, yeah, it's great advice. Thank you for that. And so let's talk about Chinese medicine. What does Chinese medicine say about treating symptoms of MVD or heart-related issues?
Okay. So in my book, there are multiple heart recipes. So there's one just to support heart function. So the heart, like treats like. So one of the reasons heart is in every one of those recipes, and it's in my pup loaf recipe, is because I'm very concerned about good heart function. So if you can source heart muscle, and it doesn't matter what animal it comes from, if you can get some heart muscle into that diet, you are going to improve heart function. The heart is an organ that is blood related. When you think about it, it pumps the blood through the body. So things that are good blood tonics, things that support rich, healthy blood. So we've got egg yolks, sardines, dark leafy green vegetables. The liver is the organ that actually makes blood. From a Chinese medicine, I know we all know it's bone marrow that makes it, but from a medicine standpoint, we have to also support the liver. So we're going to put some liver in those diets as well. So there's just a general heart support diet. Then we talk about heart qi. Qi is energy. So the heart needs good qi or good energy to pump. And that's one of the problems that we have in our dogs that are going into heart failure, and their heart muscle is getting weaker. So if you stand there and watch the echocardiogram, your cardiologist might say, oh man, the contractility of that ventricle is only at 25%. And if you look at it, you'll see that the muscle is just kind of going in waves instead of a nice strong contraction. You're getting that thinning of the muscle and the weakening of the muscle. So the heart qi diet adds qi tonics or energy tonics, things that are going to help improve energy and give energy. And then we have the heart draining diet. So for dogs who are now going into congestive heart failure and they're starting to get fluid accumulation, whether it's in the lungs or in the abdomen, and that really is a function of which side of the heart is failing worse, where you get that fluid buildup. But the draining diet is going to add things like celery or asparagus, things that are going to help drain that fluid. So I get a lot of emails from people saying, oh my gosh, the dog is on so much Lasix and we're on spironolactone, or we've switched over to torsemide, which, by the way, torsemide was a lifesaver for Pookie. And interesting, I find that cardiologists are reluctant to go to torsemide. I had a client who was emailing me, and she lived across country from me, so I couldn't prescribe things for her. And this dog literally was in end-stage heart failure, and the cardiologist absolutely refused to switch to torsemide. And I knew if we could get that dog on torsemide, it would make all the difference in the world for the fluid accumulation for this dog. And the veterinarian just refused. And her
Wow.
traditional veterinarian said, well, I won't do it if the cardiologist won't do it. And the cardiologist's response was, well, that's really hard on the kidneys. Well, I'm sorry, this dog is dying. It has so much fluid in its abdomen and its lungs, and you're withholding something because you might affect the kidneys. And by the way, it never
Yeah.
affected Cookie, and she was on it for a year and a half. So, sometimes I find the veterinarians can be so stubborn because it wasn't their idea. But so on that particular dog, what we ended up doing with her consultation with me is we put that draining diet kind of on steroids, not with drugs. But we threw so many drainers, food and herb drainers at that dog that she was able to maintain keeping that fluid out by changing the diet around and adding that in. And so sometimes one of the herbs that is talked about commonly is hawthorn.
Yes.
Hawthorn will help drain the fluid. It will help increase contractility of the heart. And in the past, I've said to people, well, you've got to be really careful. If your dog is already on pimobendan, we're already increasing contractility of the heart, and then you want to add in herbs and tea tonics that are going to increase that. But what I have over the years, I've kind of come to the thinking that unless you are using tinctures or herbs that are incredibly over concentrated, which most of them are not, most of them are gentle, most of the tinctures that are out there, that you can add them in, particularly if you're getting to that point where, okay, we've got fluid buildup, the drugs aren't controlling it, we need to add something in. So adding in those herbs, adding in foods for the draining, it can make a huge difference. It can save lives. I've got many testimonials of that in my emails. And you can go back and forth between those things. So even if your dog is not in heart failure, but they're on a diuretic and you're concerned, throw the draining diet into their rotation. So for our dogs with heart disease, if I were using only, whole food, homemade diets, I would rotate between heart support, heart chi, and heart draining, because I think that all three of them play a role. The ingredients are fairly similar. You're just tweaking little things.
Very good advice. Thank you for that. The now some people do go to like dandelion and other things.
That's just another great. That's in the recipes. Dandelion greens are phenomenal. They're kind of hard to find. I was doing a consult the other day for somebody, and I mentioned dandelion green or dandelion root, and she said, "Oh my gosh, my yard is full of them." And she said, "I use them for my husband who struggles with kidney stones." And she said, "I never thought of it for the dogs." She said, "I'm going out to get them right now." But she was making her own herbal tinctures, and she was pretty cool.
Yeah, and I think the struggle is many people have a hard time finding the professionals that understand all this. So they end up experimenting really themselves.
Yep.
Without consulting with someone who really is knowledgeable about this, because there's not a lot of people you feel that you can go to for advice on this.
Not very many. There are, obviously we're getting more and more TCVM practitioners out there because Dr. Shea down at the Chi Institute is doing a phenomenal job at teaching and cranking things out as fast as he can. I don't know where that man finds his energy. But he kind of has a team now teaching. I just saw, we're in Raleigh, North Carolina right now at visiting my daughter. And I just saw that Dr. Shea now has a beginning acupuncture course being offered here in Raleigh in a couple of weeks. And so he's all over the world. We're training more doctors. But I took my first acupuncture course 20 years ago. So I've been playing with this stuff for a long time. And while we are training more and more doctors, a lot of them are, still very green and very novice at it. And for me, because of the Cavaliers, I have a huge interest. Well, first of all, I have a huge interest in the food therapy, but I have a huge interest in the heart as well, because we obviously have to deal with that with our breed.
Yes.
So, if you find veterinarians who are Cavalier lovers, that could be extremely helpful, just because the Cavaliers have the problem. And I realize that many people in the Mighty Hearts group have, dogs of all breeds, but a lot of these small breed dogs share the same issues and problems. So it is hard. You can glean a ton of information from, just Googling articles on these by, articles by me, by Peter DeBias, by dogs, people from Dogs Naturally. They've got a lot of good veterinarians writing articles for them. They've got a lot of herbalists. Rita Hogan is pretty phenomenal. I don't do homeopathics, but there are certainly homeopathic veterinarians out there that have an awful lot to offer as well. You can find a lot of good information, but definitely check the credentials of, the people that are writing the articles that you're reading, because I find there's also a ton of bad information. And a lot of that bad information is, and I'm not trying to insult anyone, but a lot of it is people that don't have any real training. I had the opportunity. This is quite a few years ago now. Somebody wanted to do a food consultation on the phone with me, and I said, okay, that's fine. And she said, well, it needs to be a 3-way call because my dog trainer, who also does nutritional consults, is going to be on the call as well. And the dog had a liver problem and had liver nodules, and I thought, well, this will be interesting. So I agreed to do it. And so when we got on the phone call, I said, well, what are you feeding the dog now? Well, my dog trainer / nutritionist made the diet for me. And I didn't know this person. So, and I said, okay, well, tell me what the diet is. And she read me what the diet was. And I would say 90% of the ingredients that were in that diet were things that I would not have put near that dog. And so then it became a real fun way to try to be tactful about that wasn't going to work, and I was going to completely change everything that we were doing. So what I said before I started on my, this is what we're going to do, I said, well, where did you get your training to be a dog nutritionist? Because I wanted to know what her background was so I knew who else I was insulting in the process. And she said, I watched some videos online. I read some books. I went,
Oh dear.
oh. So there are people out there who are charging all of you people who are pet owners. Find out what the credentials are. Find out what the training is. And I will get people who will email me and say, are you a board certified veterinary nutritionist? And I very proudly say no, because I'm not going to use Balance It. But I have some people who absolutely will not do a nutritional consultation with me because I am not a board certified veterinary nutritionist.
Which is crazy because a board certified cardiologist told me there was nothing I could do to save my dog with mitral valve disease.
Exactly.
So go figure.
So, but for some people, and I do tell people, find out what their credentials are, find out what their training is, find out what they're doing, how long they've been doing it. And, because if they're just somebody who's read a couple of books and watched a couple of seminars or webinars, they haven't had to pass a test of any sort. They, they're kind of putting things together that may or may not be helpful for you. So, and there's, when you go online, I kind of look on Amazon once in a while to see what other dog cookbooks are out there. There's a lot of bad ones. So,
yes.
And it's hard for the average consumer. You just have to ask a lot of questions.
Yeah, basically. That's so. I wanted to also talk about, it probably kind of correlates to everything we've been talking about, is one of the best ways before going into such a major surgery like most of our families do, and they do have months to prepare because they're waiting to go. Not like a surgery where, you need to go right away and you can't just prepare to build your dog's immune system. What are good ways to strengthen their dog before they go to such harsh, it's a very harsh intervention, and they got to be in their top performance, as far as their immune system, and what are good ways that they can do that?
So diet, that's the foundation of everything. So you want to have them on the healthiest, least processed diet that you can. And for traveling overseas, you're certainly not going to be going with a raw diet, at least not a frozen raw diet. That's pretty
Yeah.
impossible to do. And I think even bringing food from one country to another can be very difficult. So you may have to research what's going to be available on the other end. And that's one of the nice things about using whole foods. It's like I can buy eggs in a foreign country, pretty much. So if you have a pretty good idea of food that you could prepare there, things, look at what you'll be able to source. And you have so many people on your site that have gone and had the procedure done, so they can give people, like I was on there the other day and I saw that people were like, oh, here's the subway system, here's the stops.
Yep.
People are so good about just giving you, because you're so worried about your pet. The last thing you want to worry about is, how do I get from the apartment I'm renting over to the university. So um,
Yep.
so having good nutrition on board, and then knowing how you're going to handle that nutrition over there, that's one thing that you definitely want to look at. Supplements that can really help, and you'll have to talk to the surgeons to see what things you would have to stop ahead of time. So a lot of people use fish oil, which is great. Omega-3s are so beneficial for heart health.
Yep.
However, they can increase bleeding. So your surgeon may say, well, no omega-3 fish oils for 2 weeks prior to surgery. They'll let you know when, you're going to need to give them a full list of what you're using and ask them what has to stop. I'm a huge
Yep.
fan of CoQ10. You can use CoQ10 or ubiquinol. Great study that I reference quite often that showed that for dogs under 22 pounds, 100 milligrams of CoQ10 twice a day actually was able to shrink the heart size and improve heart function. For dogs over 22 pounds, you're going to go up on that. So we kind of titrate up. Nobody did studies to see where the cutoffs are, but I use at least 200 milligrams twice a day for the larger dogs. Our Cavaliers, even though they're under the 22 pounds, I've been giving them 200 twice a day. You're not going to hurt them with it.
Yep.
It's an antioxidant and just really good for heart function. So I would strongly recommend that. But again, check with the surgeon on any supplements that you're using. I really like high quality mushroom supplements. I think that they're incredibly good for the immune system. There is a Chinese herb, if you work with a TCVM practitioner, called Wei Qi Booster, which is just an immune system booster, and it will help kick the platelets up. Was it your dog that had the low platelets after surgery?
Yeah, I did do that. I'm not even going to try and say the name of the product.
Yeah.
Louis
So
Vuitton or something like that.
yeah, so
It helped.
there are great herbal products that will bring platelets up, that will bring the white cell count up. So if you're struggling with those sorts of things, and then post surgery, if they're having kidney problems. So this is a huge insult to the body when these dogs undergo this. This is a major surgery. They're
Right.
under anesthesia for a while, and the kidneys can crash. Anything can decide to go into disaster mode. And so I think Nate emailed me and said, okay, I've got this problem. What do I, I think he's emailing a lot of people saying, all right,
Calling
what
me
do
out.
but kind of having somebody that you can call on for that sort of thing, if things start to go awry. But those are probably my big three: the mushroom supplements, the omega-3s, and the CoQ10. We've got all of our dogs ever since I started uh, with the deer velvet supplements. Deer velvet stimulates stem cells.
Yep.
So I feel like, especially when we're trying to save those mitral valves and we're trying to rebuild tissue, the deer velvet can be extremely beneficial. And I actually feel like, since we've had our dogs on that, that's one of the reasons that their heart just hasn't been declining. So, for the small dogs, the wellness formula is great. For the bigger dogs, we have the senior formula that does have ginkgo, ginseng. Can't remember, which is just for circulation to the brain. But again, any supplements, check with your cardiologist if you're going to take the dog for surgery.
Very good advice. So, and I wanted to also share, if people want to check out your website, which is drjudymorgan.com, to find a lot of your cool products that I really do believe in and I use myself. Zoe loves the dental drops.
Oh yeah, the dental drops. Well, and that's something else that is a big issue for these dogs, because many of these dogs cannot undergo anesthesia for a dental cleaning. Um, and I get a lot of people who email me and say, my dog's teeth are horrible. My veterinarian absolutely will not sedate my dog. Whether they're going for heart surgery or not, the veterinarian refuses to sedate them. And
Yeah.
sometimes I feel like we're doing our pets a disservice because they've got painful, loose, rotten, infected teeth. Um, and, I've had dental pain in the past, and it's pretty awful. And it is amazing that our animals don't complain.
Yep.
But if you can smell their breath from across the room, you need to be doing something. So the dental drops have been, a way to at least try to keep infection and inflammation down. If your animal cannot undergo anesthesia, but don't send me an email that says, well, my dog's teeth are still loose and rotten and smell bad. If you have loose, rotten teeth, there's no supplement in the world that is going to solve that problem. Um, if your dog will allow brushing, mixing the dental drops with a little bit of coconut oil and using that on the toothbrush is an amazing combination. Particularly, I'm going to mention brands if you're using the cocoa
Go
therapy,
for it.
because cocoa therapy is very high in lauric acid, which is a great antibacterial. So when you mix that with my dental drops, you have a product that is all natural and amazing for dental care. So if your dogs will let you brush, do that. So I have a lot of clients that they'll brush with that once a day, and then the other, at night before they go to bed, they'll just put the drops on. And let them sleep with that in their mouth, and they can do a pretty good job. But if their teeth are really, 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 really bad and they can't undergo anesthesia, just be aware that they are painful, and that doesn't matter what product you use. You basically are just waiting for the teeth to fall out. We have
Yep.
toothless dogs at our house, and they do fine with no teeth.
Yep. I remember back in the early days when I was doing a lot of research on holistic and better care for my dog, I was using dental spray products from big stores. And I remember you did a post where you listed the ingredients, but obviously you didn't talk about what it was because the lawyers will come after you. But I looked at the ingredient and I said, "Oh crap! This is exactly what I'm using." Threw it out.
Yep.
And I looked into other products, and I got your dental drops, and I actually do use cocoa therapy in combination with yours. Sometimes the Animalio dog breath,
Yeah. Great stuff.
I mix it all in together, and I've been brushing her teeth since I had Zoe at like 2 months old. And
That's really when you want to start.
yeah, she actually lets me do it for like 5 minutes straight, like won't
That's awesome.
stop. And she's never had a cleaning. She's probably due for at least one major cleaning in her life, and I'm hesitant. But like most of our families, it's after you do this surgery, it's a scary thing to think about going to get the dogs cleanings or put them out
Yeah.
for
Absolutely.
that, because it's a scary thing to even before surgery, people who have heart issues are so worried about it.
Mm-hmm.
And the ones that do have their cardiologist in house with them on the
Right.
same day they're doing it, so they can monitor everything if they
Yeah.
really
And that's a
must
great
do
way
it.
to do it. For these dogs that have advanced heart disease, whether they're going to have heart surgery or not, many times when people say to me, the teeth are so bad, I know they're painful, I need to do something, I'm really worried about it. And my answer is, then you find a specialty center that has a board certified anesthesiologist, that has a board certified cardiologist, and has a board certified dentist. And you have everybody there available to, make the best protocol, because there are thousands of anesthetic protocols that can be used. And that's one of the reasons that we want lab work ahead of time, and that we want heart function studies, particularly in these dogs, so that the anesthetic can be tailored to that individual animal. And if your animal is undergoing anesthesia, that's an area you don't want to skimp. You know,
Yep.
when people say, well, I don't want to do a chest x-ray ahead of time, I don't want to do lab work ahead of time, and I'm like, okay, well, I'll take my best guess, but it's a best guess, and it increases the risk, and it may increase the risk tenfold.
Yep. Exactly. So, well, that's pretty much all the questions that I have. I think you did a really amazing job answering so many wonderful questions that people would have, and I'll open it up now to Q&A if anybody wants to ask away their question.
There's like 1,000 comments in here.
I don't even know where to begin on that.
No.
So I will, I guess, just if there's any one of them you want to pick at, go for it.
Somebody said, what about elk bones? I sell for good. I don't sell elk bones. The only thing that chew that we have on our website is ram horns. The difference between antlers and horns are made out of compressed hair, whereas antlers are hard. Antlers break teeth. I'm not a fan of antlers, but the ram horns, when we found those, I was really excited because they're actually compressed hair, and so they break down and it's digestible. And it softens up so it doesn't break teeth. Can a diet change improve the disease or even reverse it? Yeah, absolutely.
Someone
Absolutely.
asked, Lily asked, can we give too much fresh turmeric?
Yeah, you can actually. So turmeric is a chi tonic, which is great. It is an anti-inflammatory. It helps fight cancer, but it also decreases platelet stickiness. So again, that's one of those things. If your animal is undergoing a surgical procedure, you probably should stop a couple weeks ahead of time. You definitely should tell your veterinarian if you're using golden paste or turmeric. So I would say yes, and not all animals like the taste of it, and you definitely don't want to turn them off from their food. Somebody says here, what causes high platelets? High platelets is a sign of inflammation. So it's not a specific sign. So we don't necessarily know where the inflammation is, but it is definitely a sign of inflammation. You can get a platelet cancer in the bone marrow. So I have one dog, normal platelet counts around 400,000. And we watched this dog as a Doberman who has heart failure and a million other problems, now gone into kidney failure. But his platelets, when I first met him, were running in the 800,000 range. And then over the course of a year, we watched them go up to 1,800. And I said, your dog has a myeloma. This dog has a platelet cancer. And unfortunately, she decided to go for chemo. The chemo put him into kidney failure, so had to stop that. And he's just been one thing after another, but the owner's great and he's actually doing pretty darn well. Good mushroom supplements, there's a lot of them out there. I personally use the Solaris from Dr. Harvey's, but there's a ton of them on the market. I'm just going up here quickly to see. Somebody said that their dog was put on furosemide and he died a couple days later of kidney failure and would never use the stuff. Certainly can happen. I went to a lecture years ago on heart disease, and not just mitral valve, heart disease in general. And the cardiologist was talking about the use of furosemide. And at that time, what he said was, I would never put a dog on furosemide without also having the dog on enalapril, because the enalapril will spare the kidneys from the damage with the furosemide. You also have to look at the dose of furosemide that's being given. And, the question is, what was that dog's kidney function at the time it was put on the furosemide? So unless we knew, and that's, again, one of those reasons, you're making a drug change, you should be having blood work. The veterinarian should know what the stance is at that time that you're making a change, and then follow up depending on the stability of the dog, whether you need to follow up that lab work in a week, a month, 45 days, whatever that's going to be, depending on how critical things are at the time. Somebody's saying, should a normal healthy dog take CoQ10? I give it to all of our guys. Not that George is healthy. Everybody else has issues.
Yeah, I know. They've done studies where they've given CoQ10, a lot of CoQ10 to dogs, in fact, trying to kill them, and they couldn't.
Yeah.
So,
It's kind of like taurine. I have a client whose golden retriever just, even on a really high quality diet now, it was on a bad diet, and its taurine level was 47 when it needs to be over 250. And it was starting to have heart problems. And that particular dog, even with a high quality diet, we were having to supplement 6,000 milligrams of taurine on top of that. This dog just is not converting for whatever reason. And so I had to. They said, "Well, can we give him too much? Can we kill him with taurine?" And the answer is no, you can't. So you can give extra.
No, and that's why I love the answers: goat's milk and kefir, and
Yep.
so many good products that are
Yep.
whole.
Yes, exactly.
Beth asked, best diet for diabetes.
You know, I used to have a pat answer for that, and then I had a couple of dogs who made my life really difficult and did not respond. But really, my feeling for diabetes is you've got to get the carbs out of the diet. So you want the no starches at all. Um, so I get all the starches out of their diet. I do use a lot of veggies, but I'm using fibrous veggies, green beans and broccoli and cauliflower, and kind of the same things that I would do for cancer. So in my book, there aren't diets that are called the diabetic diet, but if you read at the top of a lot of them, it'll say this diet would also be good for diabetes or Cushing's, because they're very similar. We need to support the liver in both of those diseases, and we need to get those carbs lowered. So a dry kibble diet, in my opinion, should never be fed to a diabetic pet because the carbs are just going to be way too high.
Exactly. And Jean has a question about, are supplements post-MVD surgery to support heart the same as pre-surgery? I guess meaning, can you continue your regimen after such a thing?
I would personally, but again, check with the cardiologist as to when you can restart those things. Anything that might interfere. I haven't had a dog go through the surgery, so I haven't talked to those cardiologists, but I would definitely check with them to, make sure when is a good time to restart. Because anything can happen with these dogs. Like Nate had to go through the surgery twice. So I think we still want to be supporting heart function. Absolutely.
Yep, I know. But yeah, I think the doctors usually don't want them, especially before surgery, on like something as far as like turmeric. They don't want them on turmeric. They don't fish oils like a week or so. I think it's a few weeks before surgery.
Yeah.
And after surgery, a majority of people are on blood thinner, Plavix.
Right.
So, which I believe they've said a little bit after surgery that it's okay to put them back on it, but most people just wait till after the 3-month post-op, Plavix is finished, and then they'll reintroduce it slowly. But yeah. And any other questions that you want to answer? Are we about out of time?
We've been going
74 minutes.
You guys are good.
So maybe we'll just take one more question and we will wrap it up. So you can go enjoy your Sunday.
Well, we're down here working on the new warehouse, so we're having fun.
And which I love, by the way. I think your daughter doing this with you that'll be a fantastic thing.
Yeah, my daughter and son-in-law are workaholics. They rented our new warehouse space, and as soon as we have it put together, I'll do a live and show you the new space. But they have been working really, really hard trying to get everything. I mean, they've been putting in 15-hour days trying to get it ready for us to come down and visit. And my son-in-law, he can't just go out and buy a desk. He had to build the desks.
Of course.
So everything is custom made. He custom made this beautiful barn door, the sliding door. I mean, it's just, they're a little crazy, but I love it because they're so excited about it. And Gwen has been really, really good about getting into the Facebook groups and answering a lot of the questions because I don't have time. And, so yesterday we're driving around looking for the furniture that we wanted, and from the front seat, she keeps asking me, "What's the answer to this question? What's the answer to this question? What would you do with this and that?" So hopefully you guys will get a lot more of your questions answered. Medical questions she's not going to answer, but she understands the supplement lines and that sort of thing. So she'll be able to answer a lot of stuff, which will be good.
Maybe we'll end on this one. Any guidance on people dealing with pancreatitis?
Oh, man, we could do
Tough
about
one.
2 hours on that one too. So pancreatitis, everybody, and even your veterinarian, is going to associate pancreatitis with high fat. And we certainly do see it the day after Christmas when the dog got all the fat trimmings off the prime rib, and the day after Thanksgiving when the dog got all the, drippings and gravy from the turkey. Pancreatitis is an inflammatory problem. So you can get pancreatitis if there's anything that causes inflammation. The reason high cooked fat causes inflammation is because when fat is cooked, it oxidizes. Oxidation causes inflammation. So that's why Answer's Pet Food, for instance, is a very high fat diet, but it does not cause pancreatitis because you're feeding it raw and it's not oxidized.
Yep.
If you're feeding a keto diet, so Keto Pet Sanctuary, great place. They're doing all this research on keto diets for cancer, and it works really well for epileptic dogs as well. Very high fat. I mean, we're talking 70% fat that they're feeding. The dogs, they've had 0 dogs get pancreatitis because it's not cooked, it's not oxidized. I have people who are feeding their dogs prescription low-fat diets, and they are so strict, they never allow them. I mean, the only treat the dog gets is a dry piece of the kibble as a treat, and yet the dogs will repeatedly go into pancreatitis. And people say, I don't understand. I'm doing what my veterinarian tells me. I'm feeding this low-fat, pancreatitis diet. My dog keeps getting pancreatitis. Well, the problem is that there's still something causing inflammation. Clearly, it's not being caused by high fat in the diet. And people get really crazy about, I need a low fat diet, I need a 0 fat diet. Well, first of all, you can't really make a 0 fat diet and have any meat in there. Second, your dog will not survive on a 0 fat diet because we need fat soluble vitamins A, D, E, and K. And I find that many homemade diets are too low in vitamin D to begin with. And then when we try to take all that fat out of there, they're going to die. So you do not want a 0 fat diet. What you want is 0 inflammation. So I have found that home cooked or home prepared meals do very well for those dogs, much better than the processed foods. And then we need to look for other sources of inflammation within the body. So whether that's stress, if you have a pet who is a high stress animal, I find a lot of these guys are those little nervous Nellies who are just like, oh my God, the whole world is out to get me. And they just have chronic inflammation because they're so stressed all the time. So let's get their anxiety handled, get them on whole food diets that don't have a lot of oxidized fats in them. And these guys can do really, really, really well. Our Scout, years when we first got him, he suffered from pancreatitis, and I made a pancreatitis diet, which is still on my website floating around. But it was really restricted. And I found that after about 6 weeks on that diet, he did great. But after 6 weeks on that diet, his coat looked like poo. It was dry, it was flaky, it was brittle, his joints hurt because we needed those healthy fats in his diet. So then I had to gradually move him back up. And I have found that a lot of pancreatitis dogs will not tolerate fish oil in a liquid, but they will tolerate fish oil in a capsule. Don't know why the difference, but Scout taught me that.
Interesting.
He cannot, I give him any liquid and I get a pancreatitis flare. On the capsules, absolutely fine. So you just have to find what works for each dog. But it is really, it's an inflammation problem, and it's not necessarily just due to fats in the diet.
Yep. Very good. Thank you very much. And also, if people want to reach out to you, you do consultations as well.
I do.
On your website.
So there is a link on the drjudymorgan.com website for consultations. And actually that link will take you to my clinic website, which is claytonvetnj.com. You can also just email us. through the website, and we will get you information on that. We do in office if you can get to New Jersey. We have 2 clinics in southern New Jersey, and I also do phone or Skype. We've done Skype for people all around the world. We now have clients in Sweden and England and Canada, Turkey.
Wow.
I,
Yep.
it's kind the internet is a thing.
Yep. You've helped some of our members as well. They've done phone consultations with you, and you really helped them out.
Good.
So again, thank you for your time. I always love talking with you, and maybe one day when I go to an event, we can actually sit down and talk for a bit.
Sounds good to me.
You're always
Yeah,
running
I think
around
last time
interviewing.
every time we're together, there's a million other people, and we're kind of trying to scream down a dinner table. And
Yes. So thank you, Dr. Morgan.
thanks everyone for tuning in.
Yes. Thank you, everybody. Bye.